we are going to discuss on the topic monitoring of diabetes. So before going into the topic, we will just briefly discuss a case scenario so that you can understand the topic in a better way. So this is a case, 52 years old male patient. He is a type 2 diabetes for the past 3 years, also hypertensive since 3 years. He is a smoker and non-alcoholic. He is not under regular follow-up and has a poor drug compliance. Presently, he is on glimepiride 2 mg per day, metformin 2000 mg per day and ramipril 5 mg per day. On examination, obese with BMI 31 kg per meter square, and his blood pressure was 140 by 90 millimeters of mercury, and systemic examination was normal, and his investigations include fasting 160 milligrams per deciliter, postprandial 280 milligrams per deciliter, and HbA1c 9.5%, serum creatinine 1.2 milligrams per deciliter, and his lipid profile showed total cholesterol 240 milligrams per deciliter, triglycerides 280 milligrams per deciliter, HDL 28 milligrams per deciliter, and LDL 156 milligrams per deciliter. So after going through the case scenario, questions are: what is the glycemic and metabolic control in this patient? What should be the targets of control? And how should we achieve these targets in this patient? And do you screen for nephropathy, retinopathy, neuropathy and cardiovascular status in this patient? If so, when and with what test? Coming to monitoring of diabetes, the monitoring should form part of the treatment along with diet and drugs for successful management of diabetes. Diabetes Control and Complication Trial, DCCT, popularly known as, and which is a landmark trial done in type 1 diabetes patients, showed that control of blood sugar decreases the development and progression of the complications. What are the aims of monitoring? The aims of monitoring are for adjusting therapy so as to maintain blood chemistry, that is, maintenance of metabolic parameters, which includes blood sugars and the lipids, and blood pressure management and weight as near normal as possible to avoid the long-term complications, and for detecting acute complications like hypoglycemia, ketoacidosis, and the hyperosmolar hyperglycemic status. So what to be monitored? Glycemic status, the blood pressure, metabolic and other biochemical parameters, and weight should be monitored, and screening if at all if the patient is not having any complication status, and if the patient already has micro or macrovascular complications, progression of the status should be monitored for both micro and the macrovascular complications.